So for those of you who are on the line, I think we have 3 participants. We'll go ahead and get started. Welcome, everybody, to this virtual ICFP event. Today, we're just going to be talking about the topic of media-driven accountability for a healthier young generation. This is going to be an informal discussion. Let me introduce myself. My name is Alana Barton. I'm the Director of Media Programs at the Population Reference Bureau, or PRB, in Washington, D.C. And I'll just briefly say that I'll be asking all of you to tell us how you work with media in the scope of your work. So I'll tell you how I work with media. I run media programs where we train journalists in reporting in depth on health and population topics. And I also train advocates in working with multimedia and engaging with media. So that's how I work with media. And I also work with groups of youth, either as advocates or as journalists. So let me just change my view here so I can see our slides. So as we get started, I'm actually really glad that we have a small group because I think it'll be easier to manage the conversation, and also it'll give each of us more time to sort of talk. It'll be easier for us to engage as a small group rather than a big one. But let me just go over a few of the ground rules for today's conversation before we get started. First, if you can turn on your camera, if you're in a place where you can do that and you're comfortable doing that, please do that. It just, helps to sort of simulate the experience of being in a room with each other, which unfortunately we can't be today because of COVID. If you want to make a remark or you want to speak or you have an idea to contribute, that's what this is all about. This is supposed to be dialogue driven by our participants. Please just use the raise hand feature, which will keep us from talking over each other today. So whenever you want to speak, just use the raise hand feature. We'll try to go ahead and, call people in order to speak. Also, this is probably the most important rule. Make sure to mute your microphone when you're not speaking so that we're not hearing whatever is going on in the back. And we very much appreciate you doing that. Also, please use the chat function as much as you want to. If you want to agree with something someone is saying, you can sort of put that in the chat. We'll be monitoring that throughout the roundtable. Also, if you have a resource you want to share, like a link to something or some information, you can paste it into the chat. We'll be copying and recording the chat. So go ahead and remember that that's there. Use that however you wish. Also, if you could, we want to make sure that everybody has time to speak. So try to keep each of your remarks pretty brief. And then we'll try to really, spark a discussion where we're sort of speaking in rotation and all contributing our ideas to the conversation. And then also, I just ask you to please, stay on the topic that we're dealing with today, because this session will go by quickly. We now have less than an hour, and it's remarkable how time can fly when you're talking to each other. So those are all of the rules. Can we go to the next slide? Thank you. I'm just going to ask first that by way of introducing yourselves, you type a few things into the chat, and those are your name and your affiliation, whoever you work for, and then also just briefly say how you work with media or how you engage with media. I'm just sort of interested in what brought you to this roundtable today instead of one of the others, and why you're especially interested in this topic. And I'll just give you a couple minutes to do that before we get started so that we can both type in and also read each other's responses. Thanks, Halima. Thank you, Marjorie. And I don't know, James, if you're able to use the chat, but we'll just keep an eye out for your response to these questions. And Sarah, would you mind going to the next slide? Thanks. Perfect, thank you. Excellent. So this is meant to be a pretty unstructured conversation today. You know, I think it's most important to us that you are able to exchange ideas and sort of feel like you're leaving this conversation with a new perspective, with a broader network. So whatever, you know, you should really take this opportunity to exchange whatever is most useful to you. But I did create just a few guiding questions that I am, you know, interested in having the answers to, and sort of some, when I am doing my works, you know, things that I like to learn from colleagues. And those include some successes and solutions that are out there. I am always excited to hear about, you know, a model that someone's using that works really well, especially if it can be replicated, or just, you know, a success that you've had in your work, of course, under the theme of media-driven accountability. Also, any challenges or obstacles, I find that it can be particularly useful to talk about challenges with colleagues and sort of hear whether challenges are shared and how other people are addressing them. Also, I think inevitably we have to talk about COVID-19 because it has disrupted so much of the status quo in our work. And then also I'm interested in talking about new frontiers. What do you see as being, when you think, you know, a few years ahead in our field, which for all of us is the sort of international training, engagement, advocacy, accountability space. What's really like the new horizon? What are the technologies that are changing our industry? What are the you know, challenges and opportunities that are coming up? How can we think ahead and sort of make sure that we're poised to be successful in our work 3 or 5 years down the road? So I would be very happy for anyone to start the conversation. You know, we can logically start with the first question, or if, you know, an idea jumped to mind when you saw one of these other questions, go ahead and maybe speak to one of those first. But, you know, again, I'm just here to kick off the conversation. I won't be presenting to you. So the idea is really for this conversation to be guided by all of us. And I will just ask for you to use the raise hand feature and to get volunteers for sharing ideas.
Hey, this is Marjorie. I'm not sure how to use the raised hand. But I was just going to throw out, can I just unmute and speak, or how?
Absolutely.
Okay. I just put something in chat. Like I said, I'm not a media specialist myself, but I have supported a lot of youth programs. And I think there's always that quandary of trying to get young people capacitated to be able to do more themselves. And I think in the area of media, I'm going to say that I think we could still do more there. I think there are great programs that are doing a lot, but I did have this experience at PRB where there was training and materials development specific for journalists about, you know, reproductive health and family planning data. And I think if the same approach were used with young people, where they could be provided with that information and trained how to use it for advocacy purposes, and also in the media, for them to write letters to the editor and that kind of thing, I think it could be a really interesting area to strengthen. I'm sure there are great things out there, but I just think overall we could work more in that direction. So just want to throw that out there.
Yeah, this is Halima Sharif from Tanzania, and I'm glad my colleague James, I don't know how he found his way here, but thank you for this opportunity. I think for us in Tanzania, media-driven accountability, we've kind of not defined it, but we feel it's anchored on real-time data based on the media advocacy work that we've been doing over the years, the evidence that is, you know, from policy documents and on the field, the real-life life stories, and also building journalist skills in reproductive health and family planning. And through that, we've been able to at least score a few successes. And I would like to just point out that AFP Tanzania has been working at national level with the media, but also subnational level, and very much focused in areas where the CPR, the maternal health indicators, all of which are very low. And these are the northern regions. So when you hear me talk about Shinyanga region or Kagera, these are areas where, you know, there's little progress around CPR and even maternal health in general, and especially young people's sexual and reproductive health. And by working or through working with the media, we've been able to get local government authorities in those regions to pass or to enact bylaws on different aspects that are reproductive health related. For instance, we were able to get the Shinyanga regional authorities to get bylaws in some of the local government authorities at the subnational level to enact bylaws that would fight, that are against child marriages, because young girls are married off at 12, at 13, and that means they start having babies much earlier in life, and you know what that adds up into. Too many children and opportunities for young girls are curtailed. We've also seen some bylaws in another region where you cannot, you know, you are fined or jailed if you do any like sexual advances to schoolgirls. You see, so those are some examples where we've engaged the media. They've been able to use the evidence to hold government leadership accountable by taking some policy action and following them through. And there are many other examples maybe we're going to share through our discussion today. But then your question talks about current successes and solutions. For us, I feel media-driven accountability, the solution lies in building capacity of, you know, the selected number of journalists who are keen, committed, who are, you know, they are interested in the work. So you can work with them, you know, slowly and get them to use the data instead of sensationalizing these issues. Rather, just use the data, build arguments, and, you know, and discuss and enable them to dialogue with policymakers, just in a nutshell.
Halima, I have a follow-up question for you, because, you know, the ideal outcome of engaging media and generating accurate and critical reporting around family planning topics or reproductive health stories is government accountability, is that someone notices the stories and it holds officials to a higher standard. But one of the most difficult things about training journalists is that you can't control who sees the stories. The most you can do is train the journalists to produce good stories, and then someone, including an official, might read the story and act on what they're seeing. Do you do anything, or I guess how do you ensure accountability? How do you make that link? How do you make sure that the right people are seeing the stories and that they're actually leading to change?
Based on our experience, and many times, you know, big names make news. I think that still holds. And our journalism here is very event driven. So it's looking at the policymakers. Those are the ones that are, you know, they are allowed to give statements. They are, you know, they are the ones to respond to journalists' questions. You know, it's not just any Tom, Dick, or Harry. So that's the structure here. So when we build the capacity of the journalists see the value in getting out these human interest stories from communities, you know, that the policy says this, young girls have to be in school, or services for adolescents from, I don't know, 15 to 24 are free and they're supposed to be given by, you know, that's the policy guideline, okay? So when they cover these stories from the field, then it's like the voices from the people, the girls, the parents, the other people, the evidence from the ground vis-a-vis the national aspirations and targets that are set in our strategic frameworks and national policies and the CIP, the Coastal Implementation Plan. So I think when you get the journalists to use that kind of evidence, then they take that to the policymakers in their localities to start asking questions for them to respond as to what are they doing? What have they done? You know, this is the data from this locality, and these are things still happening. What are you doing as a leader, you know, to address this? So, you know, so that's how you get them to respond to actions, strict actions. And that's how you even mobilize councillors, for instance. Councillors are like members of parliament to say, well, this is a big issue and we need the government structure here to attend to this. So it's just carrying those voices and demanding answers from the government leadership. That, I mean, that has worked for us.
So I do want to circle back around to Marjorie's question, maybe a little bit later, about how do we get youth involved in these efforts? How do we equip youth to tell their own stories and to really be a part of the process of advocacy and accountability for their own needs and interests? But I want to give James the opportunity to speak. If James, you had anything to contribute, no pressure. And I also just want to sort of like, if we have any more to say on this topic about increasing accountability and how we can do that best, about some successes or solutions around that question of how do we leverage the media, how do we engage the media to increase accountability.
Thank you very much, Alana. I wanted to add to Halima's voice on how we do we ensure who reads the news. Working in the Lake and Western zones, the areas where Halima has mentioned, in the regions like Shinyanga, Mwanza, Kagera, and Geita. First of all, there are very few, when we talk about newspapers and media channels, there are fewer. And in the selection of journalists that we train, we make sure that we selected those who are, who have a voice, those that decision makers give attention to. For instance, there are newspapers that are read in government offices every day. So when you have a journalist from that newspaper, you are sure that the news in that newspaper will be read in government offices every day. So whatever is covered is, reaches the decision makers. But also when it comes to electronic media like televisions and radios, there are a few radio stations and television stations that are, voices in those areas. So those are the ones that we actually targeted. And when it comes to, the voices of the people, they also, the media themselves, the media houses themselves know how to tap into getting the voices of the people in order that they can be heard by the decision makers. Thank you very much.
Thanks. And I'm just going to call off having to use the raised hand feature because we have a small group, and I think it's fine if you just unmute yourselves and talk, which also might make things just easier in terms of the flow of conversation. I have a question / I sort of want to move on to the next guiding question. And it's actually, I'm thinking of it in the context of Tanzania because I've worked there with journalists a number of times, both working with Tanzanian journalists and also bringing international journalists and foreign correspondents into Tanzania. And the fact that the press are not completely free in Tanzania is a big challenge. The fact that, journalists, especially the ones who are good critical journalists and really try to do their jobs as accountability holders, they receive pressure and even threats from the government, from officials who don't think that open reporting is in their interests. So I'm wondering, because it's certainly not the only example of a place where the lack of press freedom is a constraint on journalists being able to report their stories fully because they maybe fear some sort of retribution. I'm wondering if you have had to deal with that at all, in the context of engaging the media, you know, maybe having to be careful about what you say, not being able to call out officials directly. Is that something that you've struggled with at all? And if so, how have you worked around that? Or maybe that's not something that you've confronted. I'm just sort of curious, because that certainly has been an overarching theme in a lot of the places that I've worked.
Thank you very much, Alana. And I think I'm glad that you've had some experiences working with journalists in Tanzania. Gone are the days during my time when I used to work with the Daily News, where we would actually, even though it was just government-owned newspapers and radio stations, there was still some level of freedom where we could do investigative reporting and get the story out there, and the government would look at whether it's a politician or an institution and take action. Those days are long gone. Right now, we have to deal with the political context, like, is it right to even cover these issues? And therefore our approach with the journalists is not really to make them investigate and uncover and get the dirty stuff out. It's actually to get the data and get those in power to look at this data and say, you know, at least we've done this, or we will do that, instead of just getting, you know, those reports out. Because then some journalists till today that we've been working with have had some cases where they were threatened after covering certain stories in their localities or in their towns, and these are just experiences we shared with journalists last September, and we told them, look, media advocacy for family planning should not let you lose your life, you know, and not live happily. Just, you know, go slow and do what you can. So yes, there's a lot of that. The political journalists have to prioritize the political agenda of the country. They have to look at the political statements, read between the lines, the do's and don'ts, and make decisions that will allow them to be safe in terms of even packaging family planning. How do they package it? So we have these periodic meetings with them, like every quarter would have a Zoom meeting, or we have the WhatsApp group and we exchange notes, and then they would bring up these issues and we'll guide them and say, you know, you're better off using this kind of terminology, or maybe this new information will help you to package that in a more diplomatic manner. So yes, we are dealing with that. And as you know, we do not have the environment right now, as far as family planning is concerned, is a bit skewed, and everybody is kind of a bit afraid of how can they openly come and talk about it. So we also package family planning within the demographic dividend argument, without telling people and discouraging journalists to tell their respective audiences that we're supposed to have this number of children. Rather, we're supposed to space so that women can have opportunities, families can be healthier, income can improve and increase, life will be better. So you see, so we are dealing with that. And every time there's a challenge like that, we find ways to repackage and re-inform the journalists. So constant communication with journalists is very critical.
Thank you. Yeah, and I know that not to like hyper focus on Tanzania, but I believe there was a law passed a few years ago that really restricts the release of data. It says that the government has to approve data that are reported publicly, which I think that was relatively new, and it really put a constraint on the ability of journalists to just use objective information to do reporting. So I think that, you know, that also is not unique to Tanzania. That's happened in other places as well. So that puts a big constraint on things. I am also interested in how that sort of blends with the taboos that we have around reproductive health reporting and talking about family planning, especially in places where, for example, the president has come out and said, no, we shouldn't be using family planning. Women should just be having as many children as they can, you know, such as Tanzania or Uganda, where that has happened. So I'm interested about sort of like taboos and how that factors into the reporting. And I think, Halima, you touched on something interesting, which is, you know, the importance of the journalists figuring out how to frame some of these topics. You know, instead of talking about contraceptive use, talking about birth spacing is a good example of how to make it, how to use language that allows you to report on these topics without, you know, without getting as much pushback or creating as much controversy. I'm wondering if anyone else has examples of approaches to doing that, of sort of how to work on these stories while working around some of the constraints that exist in certain environments.
This is Marjorie, and I'll bring my video on. Sorry, I had still getting dressed.
That's okay.
My apologies, I was on earlier. I wanted to talk about a little bit about getting back to young people, because that's my experience. I know I worked in Malawi, but I'm also from Brazil, and my experience is more in South America, that there is language, like I know with a strategy we were trying to do, we had to use youth because we couldn't address LGBTQ. And that was sort of a way to address that, as opposed to saying just, you know, young boys and girls. I moved them towards using the word youth, that I thought would be a little more all-encompassing. And in South America, there's been a lot of pushback with comprehensive sexuality education because, you know, in the conservative point of view, they see that as covering LGBTQ issues, and they don't feel comfortable with that. So having to just talk about life planning, or you know, using it a little bit more about youth development and how the health aspect is important, that's been a way to kind of go around that. But I'm curious, in sort of the other countries that some of you are working, what has been also the dynamics with, again, involving youth in part of this process and this conversation in the media realm? You know, I know that there's young adult reporters, but are there people under 18 involved in the media discussion? And do you think they're well trained yet to do that? How can we work with them more to sort of get them in the forefront of that?
I think what you've shared, Marjorie, is actually, you know, the situation is not any different in Tanzania. The sociocultural taboos and, you know, the no-go area issue around sexual and reproductive health. It's like you talk about sexuality, you're actually insinuating sexual orientation and so forth. So that is almost like a closed area where it's a no-go. A lot of the discussions are like, you can't get there. Unfortunately, I do not really know of the under maybe 25 who are fully engaged in the media, meaning the mainstream media, but I know they're very active in social media. And unfortunately, the social media, we as AFP do engage the social media, and we're actually just focusing on policy change and applauding some positive government moves and so forth. We're not trying to be controversial, but then a selected or a devoted kind of a youth voice on these issues, that's what is lacking. And I don't know how that can come about, but I believe through some youth coalitions or youth-led CSOs, I think that would be an area, that's the new frontier that you're talking about, Alana. I think we haven't exploited the voices of young people through their own CSOs. I think they are more able to use the social media and speak out, and not speak out in a controversial manner, but speak out to enable other stakeholders and the government to act on what their needs are. And that means there need to be some kind of training orientation so that they remain politically and culturally sensitive. And that's a big thing to do. But I feel that's an area that as advocates, I think we do need to exploit that. It's an opportunity that we haven't tapped on. We work with the Youth Coalition, TIRE, and they are very active in the social media, but a lot of what's happening, you know, is, you know, just commenting on SRH. They're older young people. They are 25 and above. But that generation of 15 to 24 is what I think we should be focusing on if we have to get them actively involved in media, not mainstream, but social media. I think there's a power there that we haven't tapped on.
And sorry, I just want to step in and say we have had someone new join us. So maybe Sani Muhammad, if you could unmute. We've done some introductions and started a few of our probing questions here on the slide. Sani? Okay, maybe we'll give him a minute to get settled.
So Sani is one of my favorite people and is actually this senior partner on a activity that I was going to mention where we, I do have a couple of things to add to this because there are a couple of examples of exactly what we're talking about. One is an activity that PRB works on in multiple countries, but our senior partner is in Northern Nigeria, and Sani is the head of the partner, which is a youth-led CSO, where we work directly with youth-led CSOs to do exactly what Halima, you were just talking about. Engage other youth on social media and engage broader audiences on social media with advocacy materials, with youth assembled messages, youth-driven messages about family planning priorities, about reproductive health, and just, really like it's youth-driven dialogue designed for youth. And what we do as PRB is train these teams of young people to use multimedia tools to do that advocacy, but the messages are really decided by them. And it's just sort of helping them to professionalize the presence they already have on social media and how to use that as part of their advocacy efforts as youth-led CSOs. I will let Sani add more about that later. One of the other things we do actually is training youth to work with mainstream media. And that project is in Malawi. And it's in 9 districts, but we train teams of youth reporters, and they truly are youth. They're 14 to 19 years old, so pretty young. And we have groups in each of the districts that work with a partner radio station, and they produce their own programming. We have young people as young as 14 really acting as reporters. They go out to district offices, they go to youth-friendly health service sites, they go into the communities and interview sources, put together news packages about the stories that matter to them. And that has been tremendously successful, partly because we have really good partner stations that give the youth the freedom and the space and the technical support to create those programs, but also because the voices of youth being on the radio and really driving the content is so novel that all of the youth in the community have really rallied around those groups of young people who are reporting. So we're able to get past a lot of the taboos that usually keep media from talking about youth and reproductive health, since that combination is especially sensitive. People don't like the idea of youth and reproductive health. They think that it implies, early sexual activity or whatever, when really we're talking about a lot more than that. So, the youth in the communities really, they see the value in having their voices heard, and they have stepped up then to promote their own interests. We've had everything from youth literally building bricks for a youth-friendly health service center to build a building where they can have youth-friendly health services, to we're doing a letter campaign to district officials to open up provisions for youth or create bylaws that allow youth to have better access to family planning. So it has led to a lot of grassroots activity, but moreover, what you had mentioned, Halima, like real engagement and interest in and buy-in to change and participation in local governance, that I think is really important to start at an early age. And we've done that through that activity, which I think, Marjorie, is also a little bit what you were talking about, just like giving youth the knowledge, the tools to do that. But if I may say, I think the biggest barrier to youth not getting involved is us, the establishment, because a lot of people talk about youth, but few talk to youth and directly engage them in participating. We all, want to give lip service to the idea of youth being engaged, but then when it comes right down to it, the leadership is still, older on a lot of these projects and in organizations. we're still not quite willing to give too much autonomy to young people to determine their own priorities and to really, start organizations to do the important work that has to be done to lay a real foundation of youth-led progress and engagement. So I think that's something that we have to confront as the development sector, as organizations in whatever space we work in, really questioning, like, when we talk about youth, are we just talking about them or are we talking to them? How are we getting them involved? And is it meaningful? Are we really giving them, the resources, the knowledge, the time that they need to think for themselves, to, get engaged in a more real way? And that's, that goes all the way up through community level governance and national governance. Like, youth are marginalized a lot in those spaces. And I think it's our job to really help lift them up and, to just give them what they need to do their best work, because youth are people, they have good ideas, they have ambition, they have goals, and really all they need is just sort of like, someone to give them a leg up to just, start building something real and to become, full contributing members in whatever space they're working in. Yeah.
So this is also a time, sorry to step in, but we do have Sani back. We lost him for a minute. And then we have another new person joining us, Mubarak Idris.
Okay.
Yeah, Alana, I think
Marjorie. So it looks like a number of people had something to say. I think Marjorie, Halima, did you want to speak as well? You're nodding. James, did you? I'm just taking a survey.
Yeah, he raised his hand.
Yeah, I was just gonna give kudos to Alana. I thought your little speech there was great. That's exactly, I think, the message that I think I was trying to convey a little bit. And the difficulty that young people have with accountability of others that have promised things to them, that have, said they're gonna open spaces and engage them, and then they don't, and then they're frustrated and don't have a way to sort of, follow up on that. And how, since this panel is about advocacy and accountability, I'm thinking, how can we help young people hold others accountable, for promises made to them? I'm just working on a project right now with CDC, and they're working, and there's been lots of things, I think, just in general in the public health sector, that then, promises made and not delivered, and how to help with that. So I'll stop there to let others share.
Yeah, so I just wanted to build on what you've said. I think many years back, Bill and Melinda Gates funded a project that is called African Youth Alliance, and it was implemented in 4 countries, including Tanzania. I just wanted to pick something from there. Those times the resources were available, the project was able to bring in young people who are enlightened, empowered through the media to host. In fact, they were hosting policy dialogues with policymakers to demand answers to certain questions on SRH services, on some policies that are conflicting. And so there was debate, dialogues, and that ended up in the government coming up with youth-friendly services packages. And the media advocacy did help, and young people were part of that dialogue, because we also build their capacity. But that needs resources. And at the current moment, the resources to get young people to be part and parcel of these dialogues in mainstream media is really difficult. So I think we just need to brainstorm and see how best we can engage them in the social media piece. But the other piece that I wanted us to also look at, Alana, again, when we talk about media, youth, that are we engaging them? I want to go the other way, to get the media to drive the accountability agenda requires CSOs to equip the media, to work with the media step by step, not to just work when you have an event, Johns Hopkins, you want to do this coverage, you get the media photographer, blah, blah, blah speech. To have them as partners, as people who care about this agenda. So I think the CSOs also have a responsibility in their programs to bring in the media right from the beginning, because at the end of the day, they do contribute in ensuring that leaders are accountable to some of the policy decisions. So I think I think that is also critical on our side as CSOs.
Mhm. Thank you.
And just a quick time check, we are at 15 minutes until 11.
Great, thank you. And just to practice what we're preaching here a little bit, since Sani and Mubarak just joined, and I know, are both good representatives of what we're talking about, youth leaders who have sort of struggled to get traction in some ways because of some of the barriers that we're talking about, the difficulty of getting resources and funding and support and recognition. So I would be keen if you are willing to sort of add from your view as youth leaders, what is the most important part of engaging youth around advocacy and accountability? And we're talking about media here, but it sort of goes beyond that as well. Like what from your view do we need to do in order to better equip and engage youth in these efforts?
Thank you very much, Alana. I think the PACE project embodies the kind of projects or the kind of programs that I think fellowships or training are supposed to be given to young people. Because when we first came on the training, I had zero experience with media. Like, I know media do a lot of stuff, but media also goes beyond. We need to think at how to empower youth and communities beyond the very expensive tools and gadgets that a lot of us think with media. So we just had this training and we were able to use our smartphone to talk about child marriage, which is a reproductive health issue affecting young girls in northern Nigeria. And that got a lot of traction from policymakers, from community members, and young people had the opportunity. And one thing powerful about the media and digital tools young people have the opportunities of learning reproductive health issues from a low-risk private setting. So they have their smartphone and they learn about these issues from credible sources or from their peers as young people who also have this information. So I think media is very important, and it should be incorporated into all forms of programming, because media definitely in this world shape how people think, shapes the agenda people put out there. So for me, I think accessing even cost-effective tools for young people, maybe having a smartphone, having just a tripod, and having the basic tools and knowledge to produce little media content, maybe knowing how to navigate social media very well, or produce small content videos from their community can go a long way in educating young people about reproductive health, especially when it's coming from their peers and as well from credible sources they know.
Thanks. And Mubarak, I'll give you, if you want to say anything, and then also if James has anything to say. I can no longer see all of you on my screen, but I just want to make sure I'm not missing.
I think we lost Mubarak.
We did, okay.
Yeah.
But James had his hand raised earlier as well.
Yes.
In case James wanted to say.
Thank you very much. I was typing my point. I wanted to share about one of the most recent developments in Tanzania, particularly from the lake zone. The media has reported that the local government authorities have again enacted on formation of child councils, where the children themselves are responsible to report on either occurrences or potential occurrences of child marriages. And we think this is an initiative that needs to be monitored, and the media is monitoring there, but also needs to be supported in order to grow and do its best. And this is something that is similar to the youth movement that we have been grooming, led by Kaya, which also needs a lot of support in order to do its best in working with the media to make sure that advocacy on the issues is really moving ahead. Thank you.
So I want to point out that we have just about 5 minutes left in the conversation before we transition to just a really short evaluation for this. So I want to make sure that anyone who, you know, wants to say something or wants to make a point has the time to do that. Also, if you want to, if you're comfortable giving other people your contact information on the panel, I think we all have a whole lot more to say about this topic. I, for one, would like to have a separate conversation with each of you. I feel like we're just getting started sharing ideas about this. So if you would like to stay in touch or continue the conversation, feel free to swap contact details. If not, that's fine too, whatever you're comfortable with. But yeah, I mean, we again have sort of like, it seems like the conversation is really focused in on a couple of key issues. The idea of how to use media as an accountability tool generally for reproductive health priorities. And then also the question of youth, how to both address the needs of youth and also really engage youth in the production of media around these issues. So, you know, around those topics, does anyone have anything else they want to add before we have to close out the conversation with just a few minutes left? Marjorie, I see you.
I had a question about the PRB project. I don't know if you're able to drop the link or the name in the chat.
I did drop the name.
Okay.
We actually are redesigning our website right now, so we don't have a lot of content up about our projects, but it will be going up soon within the next like month.
Okay, I shared my email too, so if you have anything you want to share with me, I would love to pass that on to Latin America.
Yeah, absolutely.
Thank you.
And you can feel free. I'll just go ahead and put my email address in here and you can reach out to me directly.
Okay, thank you. Yeah, I think the piece about empowering young people to hold others accountable, I think would be the other kind of circle on that, to empower them and open spaces for them. But then when things aren't going their way, you know, what recourse do they have to, you know, reach out and hold people accountable?
And that's something Sunny can probably speak to, because part of what we do under this activity and what he really has been a leader in doing on behalf of his organization is not just holding leaders accountable, but really making connections directly with decision makers, with government officials, with you know, leaders in other sectors, and setting priorities together, making that relationship a lot more direct than just sort of like holding accountable. Sani, do you have any wisdom that you can quickly add around that topic? You know, what's the key to youth being a part of holding decision makers accountable in prioritizing youth priorities in reproductive health?
Thank you, Alana. I think for me, it's really about meaningful engagement and having a sense of shared power with your policymakers. Like we've used the media. So the media is a very strong tool for us here. We've gone on radio, we've used social media to call our policymakers on key issues like building health centers, prioritizing passing the Child Rights Act, domesticating child rights in Kano State. So for me, I think it's about meaningfully engaging young people to, one, understand the issues, which social media help them to coalesce around that particular issue you want them to, and centering the conversations that you really want them to focus on. So what we've been really doing is to continue to build our capacities, mobilize young people, and most especially allow them have the credible information, because government also have information that they put out there. We give them, we do our best to ensure that they are able to access credible information on these issues we want them to talk about. We go on radio, we talk about the issues, we use social media to amplify the issues, and we train them on how to center the conversations, because we know government also, like the way it operates in Africa, government also employs their media guys that do the dirty work for them. So so one of the things we do, we make sure whatever thing we're putting out there is evidence-based. It is not something that people could argue against. So we ensure all the information going out there can be fact-checked. They're appropriate information, they're good information, and there are things that young people could also relate with, because it's very important. So the message is really very powerful for us, and it's something we've used to get policy commitments from the governor in our state. We've used it to get policy commitment from the Speaker of the House of Assembly. We've even used it in some communities to get the government build schools, to get the government build primary health centers. And I think the most important thing is the messaging for us. The government doesn't want look responsible. They also want to look accountable to people. So, and we ensure that those informations are fact-checked and we push it out there. You find young people organically going towards holding them accountable. So we don't do much of the work. We just try to ensure they are able to access this information and use it for their communities.
So you touched on something important. You're appealing to the vanity of decision makers because they all want to look good in front of their constituents. So you're helping them to do that essentially by handing them messages and facts that will mobilize their actions. You know, another important piece is, of course, getting the funding dedicated to those priorities, which I think is a big piece of what we all do. Okay, thanks, Sarah. It looks like we maybe have a couple more minutes left in the chat, and then we can transition to the evaluation at 11, which is in just a few minutes. James, it looks like the floor is yours.
Oh, thank you very much. I think I wanted to comment that despite the, you know, the news about the scares, you know, the government and other things, I want to highlight that Tanzania is still, you know, open for reporting, and the opportunity is still open through the policy window, where the statements from the president have not changed any of the policies. So this is something that we are capitalizing in, and we are working with the media people building their skills based on the policy statements of the government.
Alana, I just wanted to add one thing, and I know PRB does it very well, and that is, I mean, it's not all rosy working with the media. It's a constant kind of commitment in building capacity. One big thing that the media does not have, the journalists don't have, is the skills to interpret data. So a lot of journalists are spoon-fed, you see? So we have to work extra hard for them to, maybe they don't have the time, but in our environment, the majority are not employed. They don't have a monthly salary. A lot of media houses are cutting costs. So we work with a lot of freelancers, and every time you need to, like, I don't know how to build their capacity in interpreting data, but I think two things that we have to take care. We have to be working with the media and enable them be non-confrontational, just like what Haji was talking about. That is very critical in Africa. The messaging is important. The political context, we can't lie about it. COVID coverage, we had challenges in Tanzania. You know, we can't talk about COVID. It's not improved really. That's why you don't have data from here, and I have to keep my mouth shut. I don't know who's recording this. And then we also have to understand the environment that journalists are working in. Do they have internet access? Sometimes, you know, just a mobile phone that will, you know, there are some, especially journalists at subnational level, there are some real challenges that, you know, if we have the resources, we should be taking care of those challenges. But working with a committed team of journalists is one good way to do media advocacy and ensure accountability. Thank you.
Thanks, Halima. That's actually a really important point. I see a lot of organizations, quote, engaging media, where they invite journalists for a day to learn about a topic, they spoon feed them information, and then they expect to just see great reporting come out of that. And that doesn't happen for all of the reasons you just mentioned. We have to respect what the situation that journalists are in. You know, traditional media is not a sustainable enterprise anywhere. I think that's something, you know, we're seeing a crisis in traditional media pretty much everywhere. And this isn't new. It's something that's been happening for a long time. And it's due to a variety of factors. But you're right, you know, journalists don't really have control over how they spend their time or what they publish. If they work for a news outlet, they very likely have their priorities dictated to them. They're told, go cover this, this, and this. They get paid next to nothing to do that work. So when, you know, a lot of the challenges I confront in training journalists, trying to convince journalists not to take payments for stories, trying to convince them to actually talk to firsthand sources instead of just regurgitating a press release, trying to convince them, you know, the value of understanding the facts that they're reporting so that they can interpret them for a lay audience. those are all things that a lot of journalists don't have the luxury to do because their situation is fragile and they're trying to earn a living. So one of the things that, you know, we do in our programs, and I think PRB is somewhat unique in this, in the health and population space, is we give journalists the time and the resources to do their reporting. We give them grants for their reporting, where we just give them money and say, you don't have to report on anything in particular, but go report an in-depth health story, whatever is most important to your community. Here, you know, here's some funding to go do it. And that's within the context of like a training program where we're teaching them how to report data, how to, you know, that we immerse them in subject matter on a topic. And that's something that takes a long time. Journalists cannot learn about topics in depth because they don't have the time. You know, we really have to give them that opportunity. We have to, they have few professional development opportunities, period. We really have to, you know, like support journalists fully, give them the chance to learn about the subject matter, teach them how to use the data. We can't take for granted that they bring those skills to the table. Just, you know, handing them a press release is never enough. So thanks for mentioning that. I feel like I could definitely talk about this forever, and I'm sure the rest of you could as well. I'll just ask you right before we end the conversation to type in a word or a phrase that sort of summarizes your experience during this conversation. On my end, it would probably be too short because I really would like to keep talking about this. And I really have enjoyed meeting each of you and hearing your perspectives on this topic. I think we've really just scratched the surface. And James, are you based in Dar es Salaam, perchance? I think I've met you in person.
I am in Dar es Salaam.
I swear that I've met you during one of my trips there. You just look really familiar, and for some reason I remember meeting with you. I can't remember exactly in what context though.
You're welcome again.
Thank you.
So how do we do this? How are you feeling? Like, where do we click?
You don't click anywhere, just type in the chat a word or a phrase that kind of summarizes how you're feeling.
Okay, and then I think we should be getting a 1-minute notice of the end of the session. But whenever you're ready to sign off,
Okay.
is also fine.
Well, thanks again to each of you for sharing your thoughts and ideas today. And I hope that we all meet again. And if anyone has anything else to say, I think we have 1 minute.
I just wondered if any of the recommendations here get passed on to the family planning over the umbrella, or like, you know, I think we had great things, great recommendations. So I don't know if you summarize and pass it on to powers that be, wherever that is.
We are making this small group recording available on the website, and we also save the chat as a part of recording it. But of course, if there's anything in particular, happy to pass them along. I believe we're doing an evaluation.
In there is perfect. I think she should well.
Great.
Great.
Thank you.
So Sarah, what happens now? Do we get pulled out of here, or do we just end the conversation?
I think we can end and take your break. And then of course, the rest of today's forum continues with the next session. So you can go back to the website and see which sessions you'd like to join.
Okay. Thank you. Enjoy the day, everyone.
Thank you very much, Alana. Thank you, everyone.
Thanks, Salima.